This is Philip Gander in the Department of Neurosurgery at the University of Iowa, and in this overview I will discuss our chapter on the investigation of human cognition in epilepsy surgical patients. This unique population has really afforded the opportunity to investigate the neuroscience of cognition, in large part because of the excellent spatial and temporal resolution that occurs with this technique, among others that are able to sample across the brain. And this is becoming recognized across the world, as there are a large number of centers that now employ this sort of systems neuroscience level approach in the investigation of human cognition. And this technique does require a number of special methodological considerations, and some of these will be highlighted in this chapter overview. But another real power of this approach is the fact that it can bridge the gap between invasive animal recordings and non-invasive human recordings. And really, the power of intracranial EEG in particular is really helping us now in understanding the complex nature of human cognition. Some of these methodological considerations to be included are that really, as it goes without saying, the subjects are a special population with a seizure disorder, and they often come with demonstrable neuropsychological impairments as a result of long-standing seizure disorders, which have, albeit typically unknown, impacts on typical brain function. And research involving cognition, therefore, should be really careful as to determine if there are potential subjects that are wanted to be used in research fall within a sort of normal range of cognitive function for a particular function of interest. And some investigations, such as neuropsychological testing or WADA tests, are very invaluable in helping elucidate these issues. Importantly, it should always be considered that the electrode plan and the research plan are completely independent, and any of the decisions about the electrode planning is made entirely by the clinical team. However, it is the case that often the coverage is broad enough in a given single patient that allows for multiple different research programs as they relate to cognition. And consent is something that should probably be regained at every research session, as we do at the University of Iowa, as it is not surprising that over the course of a stay as an inpatient, people's ability to perform in research or their willingness to contribute to research changes over this time, not surprisingly because of various issues like having a seizure or sleep deprivation. And the most common method that's used for epilepsy surgical patients as regards to cognitive investigation is intracranial EEG, and this comes in two sort of varieties: stereo EEG with a series of depth electrodes, or subdurally implanted strips and grids. And very nicely, each of these cases can come with customized electrode designs to allow hybrid research and clinical investigation. And the research investigation can be enabled with denser spacing of electrodes and the inclusion of microwires that allow the ability to record single or multi-unit activity. And in both cases, each of these changes do not change the risk profile for the subject and really allow special research investigations. Implantation surgery is also an issue where there can be potentially complications, and these will obviously have impact on the success of research, and these need to be considered when planning out the research. And on the figure here on the right, we can see an example of an electrode implantation surgery with a series of implanted subdural strips and grids and a number of depth electrodes. And at the University of Iowa, we often use a mixture of these two approaches. And in the middle figure, we see a radiograph of this same implantation. And on the bottom, we see a blow-up of one of these hybrid research depth electrodes. And on the lower case, the arrows point to the location of microwires at known distances with respect to the macro contacts. A very important part of the investigation of research with epilepsy surgical patients is the subsequent registration and depiction of electrode contact locations on the preoperative brain. And this is done with a multimodal approach through imaging from CT, MRI, and intraoperative photos. And there are a number of techniques that exist to allow this. We found at the University of Iowa that a nonlinear co-registration between post-implantation MRI and pre-implantation MRI works well, but importantly, manual guidance is needed rather than complete reliance on an automated algorithm. Subdural electrodes, as shown in these reconstructions here, can sometimes shift after implantation, and so it's important to document at the removal stage with photos again to see if any of this shift has occurred. For localization of depth electrodes, it's often made in reference to surrounding brain structures on the post-implantation MRI, and again, the nonlinear warping algorithm is very useful in aligning these locations. The brain shift that occurs with depth electrodes is often considerably less with depth electrodes, but nevertheless, there's still some manual guidance needed for registration of these pre- and post-implantation images. There are a number of methods that can be employed with epilepsy surgical patients to investigate cognition. So far I've discussed intracranial EEG, as this is the most common approach employed. And special challenges that exist for this type of approach are, of course, the safety profile with respect to implantation and subsequent recovery. But with the recording itself, often the main challenge is with electrical noise that comes because of the environment, the hospital environment that the person is placed within for research considerations. And ways to deal with this electrical noise can often be done in post-processing stages with respect to filtering. However, this needs to be applied carefully, as filtering itself can perturb the signals of interest. Other approaches include physiological measures, such as eye tracking or breathing apparatus. And this usually has the challenge of patient compliance, as patients are often overburdened with the amount of equipment that they are connected to. And the other problem here is with recording quality. We've often found that with our physiological measures that the signal is often noisy. Again, special care needs to be made for trying to record the cleanest signals as possible. Electrical stimulation is a very powerful research approach and is gold standard for functional mapping. However, special challenges here include the possibility of seizure induction, and so clinical staff are needed to monitor for after discharges. The stimulation parameters that are used can often vary widely, and there are a large number of different parameters that can be changed in order to look for activity of interest, often too many, and so this needs to be carefully looked at with respect to other literature before starting. And of course, in order to see a connection between one electrode and another, they need to be connected in some meaningful way by one or a series of synapses. And because of the limitation of the number of electrodes that are implanted, this can often represent a challenge. Cortical cooling is a very powerful approach, which involves the local reduction in temperature and provides a very focal effect, blocking a particular cortical area. Challenges are that, as far as we know, this is a technique that's used intraoperatively only and at a single site. So while these are some limitations, the technique still represents a very powerful approach to interrupting circuitry of a particularly known network of interest. And finally, a new approach that we're starting to get into at the University of Iowa is the use of non-invasive transcranial magnetic stimulation with concurrent intracranial EEG. And really, this is a powerful approach because very little is known, especially within the human brain, with respect to how TMS actually propagates information or works in cases of, say, intractable depression. The challenges here, of course, come with patient compliance, as TMS itself can be slightly painful. And there are safety issues, again, with the potential for seizure induction. And also with the other stimulation approaches, there are a large number of parameters that could be potentially manipulated with this approach. And so we highlight a few cognitive study examples under the array of many potential studies, and really just to highlight some of the flavors of research that can exist for high levels of cognition in human epilepsy patients. And one example is taken from our own lab here about the investigation of emotion, in which subjects were viewing pictures from the International Affective Pictures database. And these particular subjects were also implanted with hybrid research electrodes that had microwires to allow recording of single units. And here we show the examples from one patient in which responses of a single unit to different categories of pictures are shown. And this particular unit showed a strong response to the aversive sounds, a preferential response, which is quite interesting and tells us a little bit about how coding can differ across different stimulus categories within the brain. We continue this study to include more subjects, and then with a broader coverage of ventromedial prefrontal cortex and other prefrontal areas, we can see a number of brain regions here showing some selectivity to responses to these affective pictures. And there was no particular topography or of category, but in general, the strongest response was seen for aversive stimuli. In another study, we looked at the expectation of reward using the Iowa gambling task, which allowed us to look at assessment of expectation and punishment with respect to risky decisions for a virtual card game. And what we found in a single subject with unit and local field potential recordings in the frontal cortex is that there was a relationship between the alpha band, shown on the y-axis of the figure, between 8 and 12 hertz of the local field potential, and the prediction error, shown on the x-axis. And we see on the left-hand side, for all trials, a weak relationship between alpha band and prediction error. And if we broke out only those trials for the risky decision, then we see on the right-hand side that this correlation was driven by this sort of relationship only. This is interesting because it relates sort of particular decision-making to certain aspects of functional processing in a given region of the brain. We also conducted a study on audiovisual integration and proper naming. And there is some debate in the literature surrounding the role of the temporal pole in whether or not there is a particular representation of one modality, either audition or vision alone, or if there's a representation that is heteromodal in terms of responding to both of these in conjunction. And with a specially designed electrode we used at the University of Iowa, we covered the temporal pole and found or distributed representation of activity to either pictures or just voices, or both of these combined. And this weighed in on this debate, showing that there was, in the beta band signal, a heteromodal representation in the left anterior temporal lobe. And finally, some studies that we've done at the University of Iowa have begun to look at the distribution of processing across the human brain. And really intracranial EEG studies have helped to understand more about the distributed nature of coding for a particular entity. The grandmother cell idea is not necessarily correct with respect to a single neuron representing a particular entity. Instead, it seems that a sparse representation exists with respect to groups of neurons that respond to particular properties of objects that are shared. And we can see here in a study that we did to directly test the idea of predictive coding, whether or not we could see on a network level activity within particular frequency bands that represented different aspects of this formal theory with respect to understanding how human cognition and perception really works.